This lecture is about terminal parts of the large intestine and urinary bladder. The rectum and the anal canal are terminal parts of the large intestine. At the level of the third sacral vertebra, the sigmoid colon continues with the rectum. The rectum continues below with the anal canal, which terminates as the anus. The rectum descends along the sacrococcygeal concavity as the sacral flexure of the rectum to join the anal canal by passing through the pelvic diaphragm. The anal rectal junction is 2 or 3 centimeters in front of and slightly below the tip of the coccyx, which is opposite the apex of the prostate in males. From this level, the anal canal passes inferiorly and posteriorly from the lower end of the rectum. The posterior band is termed the perineal flexure of the rectum. The rectum forms the anal rectal angle with the upper anal canal. The rectum deviates in 3 lateral curves. The upper is convex to the right, the middle is convex to the left, and the lower is convex to the right. Both ends of the rectum are in the median plane. The lower part of the rectum is expanded to form the rectal ampulla. The rectum commonly has 3 permanent semilunar transverse or horizontal folds, most marked in rectal distension. The anal canal begins at the terminal end of the rectal ampulla, where it narrows at the pelvic floor. It terminates as the anus after passing through the perineum. As it passes through the pelvic floor, anal canal is surrounded along its entire length by the internal and external anal sphincters, which normally keep it closed. The internal anal sphincter is a smooth muscle, while external anal sphincter is skeletal muscle. The lining of the anal canal bears a number of characteristic structural features. The upper part of the anal canal is lined by mucus similar to that lining the rectum and is distinguished by a number of longitudinally oriented folds known as anal columns, which are united inferiorly by crescentic folds termed anal valves. Superior to each valve is a depression named an anal sinus. The anal valves together form a circle around the anal canal at location known as the pectinate line, which marks the approximate position of the anococcygeal membrane. Inferior of the pectinate line is a transition zone known as the anal pecten, which is lined by non-keratinized stratified squamous epithelium. The anal pecten ends inferiorly at the anocutaneous line, or where the lining of the anal canal becomes true skin. The urinary bladder is a reservoir of urine. It varies in size, shape, position, and relations according to its content. The urinary bladder is the most anterior element of the pelvic viscera. In males, it is located behind pubic symphysis and in front of the rectum. In females, it is also located behind pubic symphysis, but in front of the vagina and uterus. When empty, the urinary bladder lies entirely in the pelvic cavity, but as it distends, it expands superiorly into the abdominal cavity. The full bladder has ovoid shape. The empty bladder is shaped like a three-sided pyramid that has a base, neck, apex, superior, and two inferolateral surfaces. The base of the bladder is shaped like an inverted triangle and faces posterior-inferiorly. The two ureters enter the bladder at each of the upper corners of the base, and the urethra drains inferiorly from the lower corner of the base. The smooth triangular area between the openings of the ureters and urethra on the inside of the bladder is known as the trigone. Another part of this lecture is about blood vessels, lymphatics, and nerves of the pelvis. The internal iliac artery is the major artery of the pelvis and perineum. It originates from the common iliac artery on each side at the level of the sacroiliac joint. The artery courses inferiorly. It divides into anterior and posterior trunks at the level of the superior border of the greater sciatic foramen. Branches of the posterior trunk are the iliolumbar artery, the lateral sacral arteries, and superior gluteal artery. Branches of the anterior trunk of the internal iliac artery include the umbilical artery, which gives origin to the superior vesical artery, and in males, the artery of ductus deferens. The next branch of the anterior trunk of the internal iliac artery is the obturator artery, inferior vesical artery, middle rectal artery, uterine artery in females, internal pudendal artery, and inferior gluteal artery. The internal pudendal artery leaves the pelvic cavity through the greater sciatic foramen, inferior to the piriformis muscle. In association with the pudendal nerve, it passes laterally to the ischial spine and then through the lesser sciatic foramen to enter the perineum. It is the main artery of the perineum. In females, there is a uterine artery as a branch of the anterior trunk of the internal iliac artery. In males, there is artery of ductus deferens as a branch of umbilical artery, which is branch of the anterior trunk of the internal iliac artery. Lymphatic vessels from the most pelvic organs drain mainly into lymph nodes distributed along the internal iliac and external iliac arteries and their associated branches which drain into common iliac nodes and then into the lateral aortic nodes. Lymphatic vessels from the ovaries leave the pelvic cavity superiorly and drain via vessels that accompany the ovarian arteries directly into lateral aortic nodes. Lymphatic vessels from the testis drain via channels that ascend in the spermatic cord, pass through the inguinal canal, and curse up the posterior abdominal wall to connect directly with lateral aortic nodes. Branches of the sacral plexus innervate obturator internus, piriformis, levator ani, coccygeus, and external anal sphincter muscle. The major somatic nerve of the perineum is pudendal nerve. Coccygeal plexus is small plexus formed mainly by the anterior rami of the fifth sacral and coccygeal nerve, which originate inferiorly to the pelvic floor. Its branches are anococcygeal nerves, which innervate skin in the anal triangle of the perineum. The inferior hypogastric plexus or pelvic plexus consists of sympathetic and parasympathetic afferent fibers, pelvic ganglia, and afferent visceral fibers. Sympathetic afferent fibers are hypogastric nerves, sacral splanchnic nerves. Parasympathetic afferent fibers are pelvic splanchnic nerves. Afferent fibers are rectal plexus, vesical plexus, uterovaginal plexus in females, prostatic plexus in males, and deferentialis plexus also in males. The pelvic ganglia lie lateral to the pelvic viscera or within the wall of the pelvic organs. Afferent visceral fibers constitute following plexus, which innervate the pelvic organs: the rectal plexus, the uterovaginal plexus, the prostatic plexus, and the vesical plexus. Terminal branches of the inferior hypogastric plexus penetrate and pass through the deep perineal pouch and innervate erectile tissues of the penis and clitoris in the perineum. The pelvic splanchnic nerves carry parasympathetic fibers to the inferior hypogastric plexus.